Part 2. Hospitalization on the day of surgery.
You should arrive to the hospital 2.5 hours before your scheduled surgery time. Upon arrival, you will be directed to the admitting area. Here, the admitting staff will show you to the preoperative area, where you will be met by a nurse. You will spend about 2 hours here, where you will change into a hospital gown, and an IV will be inserted for fluids and antibiotics. Once you are settled, one family member may be able to join you while you wait. During this time, the surgical site will be prepared for surgery, and you will meet the anesthesiology team, who will go over how you will be sedated. At this point, you may be given anxiety medication if necessary. Also, it's important that you use the restroom to empty your bladder before leaving the preoperative area. This is the time to ask any questions or express concerns. It is our goal to keep you comfortable and minimize pain as much as possible.
You will see your surgeon and the anesthesiology team prior to your surgery. During your hospitalization, you will meet many members of the surgical team. Everyone works together closely to ensure that you receive optimal care. Although you may not see your surgeon daily, the team is in contact with him or her so that they are kept up to date regarding your progress. Since Ascension Providence Hospital is a teaching institution, medical students and resident physicians can be involved in your care. The time you spend in surgery depends on the type of procedure you are having. A catheter may be placed in your bladder during surgery to help drain urine. You will also have a bandage placed over the incisions and possibly a drain exiting the surgical site. Once surgery is completed, you will go to the post-anesthesia care unit, also known as PACU or simply the recovery room. You will be in the recovery room anywhere from a couple of hours to several hours. While you are in this phase, you will continue to awaken from surgery while being closely monitored and cared for by a specially trained nurse. You may have a bladder drain in place, which could remain there until the next morning. You may experience pain or nausea, and medication will be given to you for these symptoms. When you have awakened and are stable, you will be transferred to the surgical floor. Your family will be notified of your room number and will be allowed to meet you there. The surgical unit is comprised of private rooms. The nurses are well educated in pain management and in the proper care of spine surgery patients. You will have labs drawn each morning as needed. Depending on your surgeon, you may or may not have a small injection of heparin in your abdomen to prevent blood clots. All patients will have compression stockings on the legs to help with these as well. It is crucial that you begin to get up and walk within the first day after surgery or as soon as you can. Being sedentary after surgery will increase pain and the chance of developing a blood clot. During this time, you will be seen by members of the surgical team to check up on you to see how you're doing every day. If you are afraid of the pain you will experience right after surgery, we'll be there to help you with it. The neurosurgical nurses are well trained in pain management and in the special needs of spine surgery patients. You will have many different medications and therapies available to you, including ice packs and relaxation techniques to control your pain. You may be given opioid medication after surgery to help with your pain. Examples of these drugs include morphine, Dilaudid, hydrocodone, oxycodone, and tramadol. While we want you to be as pain-free as possible, these drugs have serious side effects, and we want our patients to use as little of them as possible. These side effects include dependence, abdominal cramps, constipation, headaches, nausea, sleepiness, vomiting, and lightheadedness. Using opioids less reduces your risk for developing an addiction. Ask your surgical team about potential alternative, non-opioid pain management options.
Post-operatively, you will be working with the physical therapist and occupational therapist. When you are deemed stable to walk with family or on your own, it is expected that you walk the halls at least 3 times per day. Ideally, you should begin walking within 8 hours after surgery or arriving on the floor. Please remember, activity promotes healing, reduces risk of complications, and decreases pain. You should also sit upright in a chair for all your meals. You will be instructed on how to use an incentive spirometer to prevent pneumonia. You should take deep breaths until the spheres or discs move to the top of the apparatus. The hospital also offers room service. There is a menu to order from that will be located at the bedside. Once you order, it will take approximately 45 minutes for your meal to be delivered.
There are many benefits of activity following surgery. It is important to move around and be out of bed as much as possible, as this can reduce the risk of developing urinary retention, constipation, pneumonia, and blood clots. People who walk regularly even report less pain. Walking helps to begin the healing process and improve strength.